Hello everyone, we're here discussing periods. I've got Dr. Danielle Haller and Dr. Helen Wiltshire from True. Danielle, the question that most of us want to know is how do we reduce the side effects of periods? The pain, the swelling, all the different effects that we have when we have our periods. How do we reduce those?
There's a couple of ways to tackle it, Christy. One is to have a look at using something that can reduce a lot of those symptoms. So, for instance, going on a contraception that stops ovulation, so the contraceptive pill or the Implanon or the depot can be used to treat a number of symptoms like heavy bleeding, mood symptoms beforehand, breast soreness, that sort of thing. Or we can tackle it more on a treat each symptom, so using pain reliever, or there's some studies that say that zinc works for period pain, using something like evening primrose oil to help reduce breast tenderness, there's a herb called Vitex agnus castus that can sometimes help with periods and mood, or some women even need to be on something as strong as an antidepressant to help with mood symptoms related to periods.
Because for some women it can actually be debilitating, the pain. Yeah. And especially the mood moving into the period. It can also be throughout the period, can't it? So some women might experience the mood pre-period and then also throughout the period.
Yeah, so keeping a diary can be a really good way of logging when the symptoms are occurring and therefore how to treat it.
And where it's happening in the period, yeah. And why do periods vary from month to month, like the colour, the consistency, the flow? Why does that happen?
So for women who are ovulating normally, we'd expect them to have a period on a pretty regular basis, and it would be usually about the same each month. But if for some reason women aren't ovulating, then their period is likely to be quite different from one time to the next, either in the flow or pain levels or the other symptoms that they're getting.
Yeah, interesting. And what colour is the blood meant to be? Is dirty brown normal, and could that actually impact on fertility?
At the start of a period, most people will find that they've got bright red or pinkish bleeding, and that tends to mean that it's fresher bleeding. As the blood takes some time to come out of the body, it can change to more of a brown or darker colour. The colour itself doesn't necessarily indicate a problem. Lighter periods tend to be more of that brownish or even more towards spotting, and that on its own doesn't have any impact on fertility.
So I suppose it's important to keep a bit of a track of the colour then? It really should vary? I mean, if it's light brown all the time, that's probably not a good thing?
If it's the same for each period that you're having, then that's probably normal for you.
Okay.
If you've got concerns about it, then a really good idea is to keep a diary. There's lots of apps available that can keep a track of your periods and symptoms and what's happening, and then take that information along to your GP to try and work out what's happening and why and whether there's a concern.
And some women have really, really heavy bleeding and they actually have to change the pad every 2 hours. Is that normal?
It depends on how long that lasts for. It can be normal, and if it only lasts for 6 hours or something like that on the first day or second day of the period, then that can be okay. But if a woman changes a saturated pad every 2 hours for 3 or 4 days during the period, then that certainly can be a sign of a problem. And she could potentially become anemic as a consequence of that, and she should really seek some medical help for that.
Definitely. And what about getting them too often? Is it normal to get a period every 3 weeks?
For most women, a normal cycle will be between 3 and 5 weeks, and that's counting from the first day of bleeding each period. If people are getting bleeding more often than that, then that is something that should get checked out by their GP.
Are clots and clumps a sign of a problem, and should we worry?
With the period, what happens is the uterus produces what we call anticoagulants that lets the blood flow out. But when clots occur, it means that the flow rate is faster than what the uterus can manage, basically. Clots of maybe less than a 10-cent piece, a few of those, again, are not a big issue, but lots of large clumps can be a sign of heavy periods.
And what does that mean?
Sometimes it can be because the uterus has become enlarged, so it can be something that happens with age. Women can get things like fibroids that can cause heavy bleeding. Sometimes there can be a hormonal imbalance that causes the bleeding. There are a number of different causes.
And it's definitely something you need to get looked at.
Certainly, yes.
Yeah. Can a period be late because you suddenly stop taking the pill after years on it?
So for some women, it will take a little bit of time for their body to come back into a normal cycle again after stopping the pill. For some people, they may have gone on the pill initially because they had irregular cycles, and that situation is still there when they stop the pill. Again, we'd say, if periods haven't come back to normal within 2 to 3 months, then that's a reason to seek medical advice.
Yeah.
And they need to consider pregnancy as well, obviously. So.
One thing that I see spoken about both in the Imperfect Mum and also in the wider community is weight gain with the pill. Is that something that actually exists, or is that a myth?
In the studies, there's no significant difference in weight gain, say, for women who are on the oral contraceptive pill and women who use a non-hormonal contraception like an IUD. Women generally gain weight as they get older anyway, and they often blame the pill. But study conditions are not necessarily reality conditions, and there is a big difference. Like when they do the studies with the pill, there are some women who will gain weight and some women who will lose weight, and so when they look at the overall picture, there's no significant weight gain, but it doesn't mean that there weren't some women in the studies who did gain weight. So it's a little bit difficult to say yes or no, but we have the same. People come to see us, they want to go off the pill because they've noticed weight gain. Weight gain will only happen if they're eating more than they're expending, so they can't sort of retain a huge amount of fluid on the pill. It's usually to do with energy intake and output ultimately.
What about women who aren't on birth control? Is there any way to shorten or delay the menstrual cycle for them?
There are some, for instance, progestogen hormone that can be used to try and control the periods and control the frequency of the periods. They can be a bit unreliable, so it's not necessarily, they're not going to get a perfect outcome with that. Some women may respond very well to that and some women may not.
And if they're wanting to lighten their period, there are some medications that can be taken just at the time of their period to reduce the amount of bleeding that they're getting.
Why do periods stop suddenly? Some women don't experience period for months but aren't pregnant. What could be the reason for that?
So again, there's a whole lot of potential reasons. We probably see this very commonly in women who are in the perimenopause, where their hormones are changing and they'll have times where they're not getting periods for some time and they get their periods back again. But there can be lots of other factors, other medical conditions, perhaps thyroid conditions, a large weight gain or a weight loss can affect hormones and periods as well.
Helen, finally, can we practice yoga during our periods?
So from a Western medical perspective, women should be able to carry on with whatever activities they want to during their period.
I'd just like to know if there is any, I know we spoke before about the different remedies. Is there any particularly natural remedies that you would recommend?
In terms of
Sorry, that's probably a bit of a broad question. In terms of pain, but also mood.
The herb Vitex agnus castus, sometimes called chaste tree or chaste berry, is potentially can be helpful. And mood. Some women use a herb called St. John's wort, and certainly in Germany they get lots of good results with St. John's wort. But a lot of different companies manufacture it, and it's not, I guess, as medicinal as a prescription medication. So one brand may be different to another brand, or one dose may be different to another dose.
Do you have a personal preference on even moving away from natural, but any type of medication, particularly for women that might be experiencing, high and down moods?
If they're needing contraception as well, then I would go along the angle of probably starting an oral contraceptive pill. Some are better than others for mood, so discussing what other needs they have as well as managing the mood part of the periods. If it was an antidepressant, so you mentioned some women are moody most of the cycle, so an antidepressant all through the cycle can help. On the other hand, if they're just getting that premenstrual moodiness, then we can use for 2 weeks on, 2 weeks off, some of the antidepressants as well.
So I think you can see that we really tailor that management and treatment to the individual person.
Yeah, and we're all so different, aren't we? Yeah, and I think that's really important to realise is that we do need to make sure we're consulting with our doctors, because it's great to sit around and talk with your friends, and I think that's really, really important, but we do need that individual consultation as well. Thank you so much, ladies. That was so great, so informative, and I learnt so much myself. Ladies, if you want to check out true.org.au for more information, or make an appointment with the Family Planning Clinic, and you actually might get an appointment with one of these ladies. And please keep sharing your questions with us, and I hope to hear from you soon. Thanks, guys.